but to stay in the glory is quite a different story, honest. I tried to leave, but there's just no place like home. So I'm a little on the edge, but I'm doing all right, at least for tonight. But I'm further along than the last time you called. Though I'm sleeping with dogs, they offer comfort when there's none. And I'm pretending not to notice that your presence isn't there after all, and that your words are conducive to the fact that you know nothing at all. Still standing tall. Still standing tall. Still standing tall.
It's 9:05 a.m. and we're going to kick things off here. So I'll call to order the Travis County Commissioners Court, and then I'll hand it off to Mayor Adler.
Judge, thank you. Steve Adler, Mayor, Austin, also convening the special called meeting of the City Council here on April 6th, 2021, 9:05. We have a quorum present as well. Judge, thank you for this. After the presentation, we'll go through questions. We'll begin with Council District 1 today and then work our way through the districts. Judge, thanks again for letting us join.
Thanks. Audrey or Nate, I'm not sure who it is today. Do we have any callers for Travis County public comment?
Judge, it's Larry Schooler, and we
Larry.
don't have any callers at the moment.
Hello, Larry. Welcome back.
Thank you very much.
All right. So same deal as last week to help ensure the efficient use of Dr. Escott and Director Hayden Howard's time and manage the length of the briefing. We're going to try to limit it to one question each in the order below. And so that'll go commissioners, county judge, council members, and then mayor. And I guess, Dr. Escott, if you are all ready, do you want to kick us off with the briefing?
Yes, sir. I hope y'all can see my screen.
Yes.
Yes.
Beautiful. Change modes here. There we go. Thank you, Judge. Thank you, Mayor, for the opportunity to update the court and the City Council on our COVID-19 response in Travis County. What I'm showing you here is an update of our new confirmed cases in the county. Yesterday, we reported 152 cases, which gives us a moving average of 105. Over the past 19 days, we've been oscillating right around 100. So not much movement there, very flat in terms of the new cases within Travis County. This is an update of our new admissions to the hospital. Yesterday, we reported 17 admissions with a moving average of 19. We've been oscillating in a tight range for the past 10 days between 16 and 19. We had some increases in our admissions on Friday and Saturday, 24 and 26 admissions, Sunday and Monday, 10 and 17. So still that oscillation up and down, but again, relatively flat in terms of admissions to the hospital. When we look at this slide, again, this is hospitalization in blue. So total hospital beds being utilized for COVID-19. The orange are ICU utilizations, and the gray is ventilator usage. So we see a general pattern here. These numbers are still decreasing, but they're decreasing very slowly. Our hospitalizations yesterday, 142, a moving average of 140. That's a 45% decrease from a month ago, from March the 5th. ICU 49 yesterday with a moving average of 52. That's a decrease of 31%. And our ventilator numbers yesterday, 22 with a moving average of 27, 52% decrease since March the 5th. Again, all those numbers are decreasing. What we're seeing now is they're decreasing really very slowly. So we'll have to keep a close eye on that. Again, when we look at the statewide numbers are following a similar pattern, decreasing but decreasing slowly. This is an update of the projections from UT. As I discussed last week, I anticipated that the projections for April were going to flatten out, and that's what we're seeing here. We talked last week about the projections at that time indicating that perhaps by mid-April we would dip down into the stage 2 territory, so less than 10 admissions. Now that date is pushed down to the end of April, beginning of May. So again, these are projections based upon the current transmission of disease. Again, if we are more protective, if we continue that masking and distancing, avoid large gatherings and so forth, we can push these numbers down quicker. Again, relatively flat, but decreasing, currently projected through April and into May. Similar patterns for hospitalization or hospital bed utilization, as well as ICU utilization. Again, relatively flat with a slow decline through the month of April. I will say, back on these slides, we're getting a lot of discussion right now, a lot of questions from our school districts. How do we plan for graduation? The answer is that, right now, if we keep the current restrictions in place, the mask mandate, the protections we have in place, things are looking pretty good for graduation time, the end of May. Again, when we look at the projections from UT regarding what happens if we relax too much in mixing the variants, so the effects of spring break and potentially Easter plus variants, then we have the potential for a surge in April, beginning in April and into May and June. So under that scenario, graduation may not look as rosy. But if we continue these protections, we continue to ride this trend down while we ramp up vaccinations, things could look very, very good for graduation at the end of May. This is an update of the hospitalizations week over week. This one is by age group. Again, we can see that we're seeing increases in the percentage of individuals hospitalized in that 20 to 29 age group, significant decreases in the 80 plus age group. A lot of the other age groups are relatively flat. You do see a decrease in the 70 to 79 age group as well this week. And I'll talk a bit more about that on the next slide. This slide is breaking down the numbers of individuals in each age group hospitalized week over week. You can see that overall last week we had a decrease of 10 in the total hospitalizations, so 164 to 154. Again, this week you see further compression of that number of individuals in the 80 plus age group as well as the 70 to 79 age group. Again, I think this is reflective of the focused effort in vaccinating older individuals. The state has been really focused on individuals over 80, and we have as well. And I think this is helping to drive down the numbers in these groups, so very low numbers in those two age groups that have a very high risk of hospitalization, ICU utilization, and death from COVID-19. We did see an increase in the 60 to 69 age group this week. The other groups are relatively flat, relatively consistent with the previous week. So again, when we see numbers down in the towards the bottom, we have 21 individuals in that 20 to 29 age group. Again, this represents significant disease transmission due to the very low rate of hospitalization for people in that age group. So again, we need all of our community to engage in those protective actions, not only when they're in public places, but when they're in private settings, so that we can further drive down transmission. This is an update of our hospitalizations by race and ethnicity. This week, in the green, we see our Latinx community decreasing from 45% of the hospitalizations to 41.8% this week. Our white non-Hispanic group increased from 38.9% to 42.2%. And our African American population, which is the gray line in the middle of the screen, 9.4% to 14.2%. So we've seen, some oscillations week over week, in particular from our African American community. Again, we want to encourage our communities of color in particular to engage in vaccination efforts if support is needed. Director Hayden Howard will be talking a bit later about how folks can access if they're having trouble utilizing the internet, as well as other opportunities for vaccination for our communities of color that continue that disproportionate impact from COVID-19. This is a breakdown similar to the age group slide. So individuals hospitalized within each of the races and ethnicities. So we saw a decrease 67 to 59 for our Latinx community, a slight increase for our white non-Hispanic community, 58 to 60, and an increase in our African American community, 14 to 20, with only one individual in our Asian American community hospitalized in the past week. This slide is an update of our positivity for the community. Last week so far, 4.5%. We did see a significant decrease in the testing results that we have so far from last week. But again, relatively flat for the past 5 weeks at around 4.5%. Again, this is consistent with what we're seeing in our hospitalization data, our ICU data, and our case data. Everything is looking very flat. This is an update of the positivity by race and ethnicity. Our Latinx community positivity 7.2% the previous week to 6.9% last week. Our African American community, a slight increase from 4% to 5.5%. Asian American community, 3% to 2.3% last week. And our white non-Hispanic members of the community, 4.1% to 3.9% last week. Again, we have a few groups over that 5% threshold where we'd like to be. It's our African American community, our Latinx community, and our Native Hawaiian or Pacific Islander. Again, our goal is to get everybody below that 3% mark, which is the green dotted line. So we do have a ways to go in terms of driving down positivity further to put us in a better situation going into later in April and May. This is a breakdown of the positivity by age group. We did see a significant decrease in the positivity in that 10 to 19 age group, the gold bar. So just over 5% this week, but an increase in our 20 to 29 age group. Again, the 20 to 29 age group may be related to spring break. We are investigating possible clusters associated with spring break trips, but we're also seeing clusters in other areas. We're investigating a cluster currently involving a church choir that, where it appears that multiple members of a church choir were exposed and now have COVID-19. So again, those protections that we've been talking about for a year, in particular those situations that we know can lead to high transmission, like singing, like using instruments that involve you blowing into those instruments. Those things can cause increased efficiency of transmission. We really still need to continue the protections, particularly in those areas. So again, we need all aspects of our community to continue those protections, continue the advice from the CDC as well as Austin Public Health, so that we can drive down disease. COVID-19 is still here, and if we take too many liberties right now in terms of risk taking, we're going to pay for it in May and in June. This is a further breakdown of the positivity based on age of the individuals in school-age children. So we see our high school individuals 5.9% positive, so significantly over the community positivity rate. Middle school, 3.6%, elementary, 3.3%, preschool, 2.8%. So we are seeing decreases in our school positivities, or positivity for school-age children, which is a good sign. Again, we're thankful to our superintendents in Travis County who are uniformly requiring masking and continuing the protections in place. Again, we have to remember that virtually no one who's a school-age student has been vaccinated. So despite the fact that community risk may be starting to decrease, particularly with vaccinations increasing, that risk for school-age students is going to continue at least through midsummer, which means planning summer school, planning summer camps, other summer activities are going to still have to build in those protections to ensure that we control the spread of disease within these age groups. We look at other countries who have achieved substantial vaccination rates, like Israel. They're experiencing surge related to younger people, individuals 19 years old and younger. So again, we have to take a lesson from other countries who've experienced this already and avoid significant surges in these younger age groups. Particularly with the variants that have some indications that they may more significantly impact those who are younger and healthier. In terms of vaccine efficacy, I can't think of a better example than what I'm showing you here, which is our long-term care facility dashboard. 4 cases in the past 14 days, 13 cases in the past 28 days. Again, a 98% reduction in transmission from just 2 months ago. So, it is a clear testament to the efficacy of vaccinations and the impact they can have. So again, we're pleased with this and look forward to ongoing decreases in our nursing home and assisted living facilities. Brief update on our regional infusion center. Again, TDEM opened this on January the 6th. Almost 1,000 patients treated so far, 926. There's still plenty of capacity for individuals who are at higher risk for severe disease to receive a free monoclonal antibody therapy. They just need to be referred there through our regional call center. This information is shared with clinicians across Travis County, and we're hopeful that if folks need this treatment, that they are referred there and can hopefully avoid hospitalization and severe disease, which these therapies have been shown to be able to decrease the risk of. Brief update on our influenza situation. Again, very low numbers of flu. We've just had more than 100 cases for the first time this season to date, so 1.18% positivity, 102 total cases for the season to date, which is remarkable. Last week, less than 1% positive. So doing very well in terms of flu. Again, this season is the blue line at the bottom, which is clearly going to be a record season. You can see from the 2019-2020 season, we're not completely out of the woods yet. We occasionally see some late season spikes in influenza. The season goes through May. Again, we continue those protections for COVID-19. It will continue to translate in decreasing transmission for influenza. Again, we remain in stage 3. I'd love for us to get down to stage 2, but it is going to take all of us continue those precautions to push down transmission so that we can push down hospitalizations and hopefully get to stage 2 by the end of April or early May. With that, I will transition over to Director Hayden Howard.
Good morning. Thank you, Dr. Escott. What we have here is an update from our vaccine dashboard. As we can see from the data, 50% of the folks that have received a vaccine are female, 48% are male. Hispanic represents 22%, African American 5%, and Asian is 11%. Next slide. We have provided over 200,000 vaccines have been administered at all of our locations in Travis County. And last week we administered 30,000 vaccines. Our mobile vaccine program continues to provide vaccines. This week we are partnering with Family Elder Care to be at some of their locations, as well as continuing to provide vaccines for folks that are homebound. As you can see, this is a photo from an event that we had this weekend. We would like to thank the Austin Black Physician Association for really stepping in and helping us to secure volunteers to provide vaccines. This is at St. James Church, and we were able to provide 543 vaccines. As you all know, this past Saturday, we had some inclement weather, and so it definitely delayed this site as well as our burger site due to the rain and inclement weather. Typically, what we do after these type of events is our team will get together and we will debrief these incidents, this type of event as we've done with Sacred Heart. Knowing that these are pilots, we look at how we can improve them. And the goal is to continue to replicate them. They have proven to be successful models of this one in St. James as well as Sacred Heart. And so our goal is that we are going to look at more events like this. Next slide. This is just an update of our vaccine for childcare education in the senior population. We provided 11,000 vaccines to school and childcare staff. They've received at least one dose of the vaccine. Our senior population, first dose 56,000 and second dose 35,000. And then according to the Texas Department of State Health Services, over 70,843 Travis County residents 65 years of age or older have been vaccinated with at least one dose. Next slide. One of the changes that we implemented on yesterday, when we released appointments on the 29th of April, we released 7,000 appointments. What we noticed is that we, at the close of that evening, we still had 2,800 appointments remaining. So we made an adjustment. And so now our eligibility has changed. We have expanded it further. 40 years of age and older can now schedule. When we released appointments on last night, we released 7,500 vaccines, and all of those were scheduled. We actually had more people looking for vaccines than we had appointments. We will continue to do that process of releasing on Monday and Thursday evening. Just a reminder, on Thursday is typically the day that we receive our first dose of vaccines, and we're continuing to receive 12,000 of those weekly. We are still waiting to hear about the Johnson & Johnson vaccine. And once we receive that, then we will definitely add that to our schedule of appointments and show the clinic where that vaccine would be provided. So we will continue this process. Next slide. I wanted to just kind of highlight this. This just gives a snapshot of City of Austin employees. I know this is a joint session, and I don't have the Travis County vaccines, but we have provided HRD and through the Public Safety Wellness Clinic, 3,400 employees have received their vaccine. Last week, 574 were registered for their first dose. We'll continue that process through the Public Safety Wellness Clinic. Initially, when we stood this up in January, we did have several county employees that came through this site. And now we also understand that county employees are also going through CODA and will continue to do so. And so this is the process that has been established. As time moves forward, HRD, they did receive about 250 vaccines, which they're going to provide on Friday. And the goal is that as Randall's has more supply, then Human Resources is going to shift totally to the Randalls to be able to provide vaccines. Just as a reminder, employees can schedule on the Austin Public Health platform. They can go to their, if their physician provides it, they can go there. They can go to any of the pharmacy programs with their insurance to be able to provide that. And so that those services are available. Next slide. I wanted to take this time to just acknowledge this is National Public Health Week. The theme is Building Bridges to Better Health, April 5th through 11th. And one of the things is there are daily themes. And so yesterday's theme was rebuilding. So as you all know, this has been a difficult year for public health, but I will tell you public health departments across the nation have really done a yeoman job. And when I think about Austin Public Health, our staff have done an awesome job over the last year and continue to do so. So I would really like to acknowledge Austin Public Health staff and all the work that we do. One of the other things I want to point out is with today's daily theme is advancing racial equity. One of the things that has really come to pass that most people had not paid any attention to, but public health workers across the nation and locally have always noticed that even though your city may be overall showing very healthy, you're on a lot of lists, there are disparities that exist in populations of color. And so the thing that was really highlighted during this time is that there was a huge impact on people of color who have been impacted by COVID. So whether it was death or severe disease, they were very, very ill. Their families were really, really devastated because of COVID. And so it is so important that as we are thinking about programs, that we lead with equity in mind. We have those conversations as well as relationships with grassroots organizations, that we listen to the public to see what kind of changes that we need to make in order for our community to be as safe as we can be. Again, I could not be here today without acknowledging my staff at Austin Public Health. And I'd like to close by saying #we are Austin Public Health. Thank you so much. That concludes my presentation.
Thank y'all both so much. Let me give just one short update about a couple other efforts. So obviously we're still doing shots at Circuit of the Americas. We did second shots last weekend. We're going to do more second shots. Sounds like there is some possibility we may get some Johnson & Johnson for the first time this weekend, or for this weekend. Still waiting to hear confirmation on that. And I think it would be a limited amount if we do get that. This past weekend, we worked with Mayor Wallace of Manor and Dr. Karen Smith to start a clinic up there. They were able to do it, and it was great. And they had similar results kind of to our first weeks, where at the first day, they did 3 days. The first day, it was a longer check-in process, longer process overall, but by the third day, they had shrunk that down to 17 minutes. So they've actually, in working with Chief Bailey, have come up with a login system that is very easy for walk-ups, and it even scans your driver's license, which is amazing. Hoping to see if we can expand that login system more for walk-up appointments. The percentages were about we're going to get more details from Dr. Smith and Mayor Wallace at 1 p.m. They weren't able to join us this morning. But the short version is 64% Latino, 11% African American, 53% female, and just about all of them from the Manor area. So it was really great results. I think they did one pizza box of Pfizer, so a little over 1,000 shots this weekend, hoping to expand that in upcoming weeks and expand that partnership. We also partnered with, I think, ARC, Dr. Jerica Hockaday continued giving shots, and Baylor Scott and White, I think, gave more shots as well in Lakeway and Pflugerville. So overall, continuing to work on getting CODA up and running to full capacity, but also expanding to these smaller clinics, working with APH and their local providers to just get the capacity up as much as possible, because it really does seem like we're kind of in that point where the state is starting to give us more and more vaccines. So really the question is if we have the ability to get them out with, and the key limiter there is, to be frank, staff. So that's my update, but I will turn it over first to Commissioner Gomez for questions, and then we will go through the other commissioners.
Judge, I don't have any questions, thank you, but I kudos to everybody who's really working hard to getting people vaccinated. This is really the goal that we have, so it looks like we're making some progress. Thank you.
Thank you, Commissioner. Commissioner Shea?
Thanks, Judge. And as usual, my thanks to all of our public health staff who are really doing incredible work, and I know continuing to work very long hours to keep us safe. I wanted to clarify a number, and then I had a question. Director Hayden Howard, I think you said it was over 200,000 some vaccines that had been given. I've forgotten the exact number, or was it over 300,000 total? Whatever that number is that, does that count 1 and 2? So should we like cut that number in half to understand how many people have been given vaccines, people versus 2 shots? Or how should we understand that number is really what I'm trying to clarify.
So 203 includes first and second doses. And so, and I don't have in front of me, but I'm gonna look at the dashboard here. About 25,000 of those have been second doses.
Oh, okay. So
That's
it's
the
not,
first and second doses.
because I was trying to get some sense of how many people had gotten vaccines, but it's hard because it's not a cut the number in half. Okay, and did those total numbers include CODA? Are we able to include the CODA numbers yet or no?
We have not put CODA with this yet. We received that information last week, and our folks are working to update our dashboard.
Okay.
So my hope is it should be updated by this time next week when we present.
And then my question was, we saw several distressing news stories about how the reservation lines had opened up for people to make reservations to get the vaccines, but went unfilled, largely unfilled. Do you know why that is? And I'm still not clear how people can go in and remove themselves. For instance, I think I signed up, but I don't know how to go in and remove myself from the system. And if that's part of the problem, I don't know if we can make it clearer for people how they can help to clean up the system. But first, any idea why we're having this lack of takers for the vaccines when we are opening it up?
Well, so last week, on the 29th was the day that we released those 7,000 appointments, and we had 2,800 left. And so that was when we were still going with 1A, 1B, and 1C only. We had not expanded it. The state of Texas does allow us to continue to work on those 3 areas to prioritize. Once we expanded it, added to 40 years of age and older, we did not have that problem on yesterday. So all of those appointments were gone, and actually we had more people requesting appointments than not. With the update in the system, you have to log into your account. And once you're in there, it will show you how to, you can click on there and say, you know, I'm no longer interested in receiving a vaccine through Austin Public Health. And then it will close out your account. And so from there, you shouldn't receive any emails or text messages. Probably one will follow just to say, you know, you've closed out your account, but then from there, you shouldn't receive any other communications. And we can send that to you just so you'll have it.
Thank you.
And Commissioner Shea, if I could just add, the numbers that Director Hayden Howard shared are for the APH vaccinations. Obviously, even beyond the CODA effort, there's many other providers in the Travis County area. So a total of almost 300,000 people in that adult age group, so 16 years old and older, are vaccinated. Sorry, 203,000 with 380,000 having at least one dose, and 86,000 people in that 65 plus age group. So the state has a dashboard that monitors all those numbers for all the providers in Travis County. So doing very well in terms of that. About 20% of our adult population is fully vaccinated.
Thank you. Commissioner Trevelyan?
Good morning. Once again, I would like to thank Director Hayden Howard and also Dr. Escott for the work that they've been doing and their availability to community. I think it should be pointed out again that they are working through structural problems in a lot of different communities. We've had I think that we've shown significant progress, but there's still structural things that we have to plan for and work through. And I just want to make sure that as we move from those areas where now that we've got better access to the vaccine, I just want to make sure that we are working through trusted institutions within the community to make sure that as we are working with family elder care, and I think that's an excellent idea, that we coordinate with churches so that they can lay out their sick and shut-in lists for us. Most churches have a list of people who, because of mobility issues, health issues, etc., cannot get to and from church very well. We want to make sure that we are coordinating with churches and making sure that family elder care has access to that type of information, because as we move into the new phase of people looking to get the vaccine, the more trusted the institution, the more likely folks are to take the shot. So I just want to make sure that we're coordinating. My office is willing to do so. We've been working together for a period of time. I just want you to know that we still want to continue to make sure we're reaching the hard to reach parts of the community. And I think our churches and our organizations are one of the primary ways. I was happy to see that African American physicians were worked with, and Dr. Jerica Thomas Hockaday has done an excellent job of not only training people to participate in this environment, but making sure that staff is available to get out into the neighborhood. So thank you for what you've done to include, to cast a wider net and make sure that trusted community people are engaged. And I just want to make sure we continue to engage churches.
Commissioner Trevelyan, just wanted to let you know that the African American churches have started referring folks to us. They've started receiving those homebound vaccines. And so we highlighted family elder care because that's a new partnership happening this week. However, in between working with family elder care and an agency, our staff are providing those vaccines to homebound individuals. And so, but we've already started receiving those referrals. And so we'll continue to receive them from church.
I appreciate the work that you've done. I just want to make sure that we capture all of the lessons learned, because we'll need to use these lessons if we're talking about testing again, if we're talking about food insecurity, if we're talking about other health-related programs. So proud of all the things that you all have been working on. I just want to make sure we document them and develop specific strategies to continue to expand on them.
Thank you, Commissioner. Commissioner Howard?
Thank you. Thanks for all the hard work. It sounds like we're making progress. And I wanted to encourage any listeners to volunteer to help keep these, monumental efforts going. It's not over, and we're in the marathon here stretch. So if you can volunteer, please get connected with any of the elected officials you see to make sure you know how to sign up. Thank you.
Thanks. I'll pass on my questions. Just want to echo Commissioner Trevelyan and say thanks Director Hayden Howard, for your work on reaching out to the community and getting some of the smaller clinics that are more targeted up and running. I think that shows great promise. So thank you so much for doing that. And Mayor, I'll pass it over to you now.
Thank you for that. I also want to thank again Dr. Escott, Dr. Hayden Howard, and please thank your staffs and also to the county staff that are executing out at CODA. These satellites that are opening up in Pflugerville, the ones that you're doing, Dr. Hayden Howard, are real important as the county and the city fulfill its role as being kind of the safety net. Most of the vaccines in the city being given out in other places, drugstores, grocery stores, and the like, are not going to have the same equity focus that is our responsibility to have. I'm encouraged to hear that you're going to give us a more complete reporting next week of that really good work with respect to equity by combining onto the dashboard the numbers with our partners at Community Care in Travis County and out at CODA, because that would give us a better feel for what the community's equity response is. And you say you think maybe at this presentation next week, we're going to be able to see those combined numbers?
Yes, Mayor.
Okay. I think that'll be real important and real helpful as we move this forward. Let's go ahead and hear from colleagues. We're going to start with Council District 1. Mayor Pro Tem, do you have a question?
I do, and a comment of gratitude, if I may. I'd just like to echo, what my colleagues at the county and here and for the city of Austin have said, and I'm certain will say, which is, extreme heartfelt gratitude for our public health department. This is one of those opportunities where, folks have been saying for years, Interim ACM Jones has been saying for years, everybody's been saying for years, we need to double, triple, quadruple down on fully supporting our public health department. And if nothing else that we've learned over the last, 16 months, my hope is that that's one of the things that we take out of this. So again, just thank you all for the work that you've done, that you continue to do, and happy Public Health Week. We really appreciate y'all very much. My question is about clusters and potential surges. Dr. Escott, you said April, May, June surge. And I guess I'm just trying to figure out what, I know that, some of the clusters that y'all are looking at now, you think are the result of spring breakers. So what demographic are we looking at having a surge with during that April, May, June timeframe?
So Councilmember, the surge would be a community-wide surge. So that's based upon modeling done by UT, taking into account the state's relaxation, plus spring break, plus the influence of variants, which we know are increasing across the country. They start with clusters. They start with pockets of infection spread, and then have the potential to expand from there to the entire community. It's important for us to continue to, for folks to get tested if they have symptoms of any kind, so that we can detect it early, we can quarantine folks, and we can limit the spread. I'll have to give our thanks to our partners at UT, who've done a phenomenal job of offering testing on campus, doing a phenomenal job of contact tracing and isolation and quarantine of those who are sick or who have been exposed, to really try to limit the spread. That's what we can do, and that's what we have to do right now to prevent that community-wide surge. Again, because we were successful in the defense of the health authority rules to keep the masking mandate in place, that should help mitigate the risk of that spread and buy us more time to get more people vaccinated.
I appreciate that. And I guess as an extension of that question, then, I've seen that there are some states and other countries that have required a very abrupt and extreme shutdown to prevent surges or to respond to some minimal surge. Is that something you anticipate us doing again or needing to do? I
don't anticipate us needing a lockdown. Unless a variant emerges that is much more infectious and much more, potentially deadly. What we're seeing happen in places like Italy right now is that, you have the relaxation combined with a slow rollout of vaccine. There's been some criticism nationally about the vaccine efforts here, but the U.S. is leading most of the world in terms of its vaccination effort. Our rates of vaccination are triple those of Italy. So we're actually doing a very good job on the global stage in terms of the vaccine rollout. So I think that's really helping us mitigate the risk of an overwhelming surge. I think any surges that we see are going to be sub-overwhelming. We'll see increases in hospitalizations, increases in ICU utilization, ventilator use, and deaths. But I think it's unlikely for us to see a surge that is going to threaten the healthcare infrastructure.
Thank you, Dr. Escott.
Councilmember Fuentes, is she with us? She had a press conference this morning with a new airline creating a base here in Austin. It's exciting. Hopefully she'll join us here momentarily. Councilmember Renteria.
Thank you, Mayor. I just like my colleagues have been saying, our true heroes are our healthcare workers that have sacrificed so much, to our society, and they really are my heroes also. So I want to say a big special thank to all y'all workers that's out there that have, committed yourself and have showed up to work day after day, seeing all the sorrows out there. My heart bleeds for all y'all workers that have to go through all of that suffering, seeing all that suffering. But my question is, Doctor, do you think it's really safe to open up our libraries in May? What do you think about us opening up right now in next month, our service to the public?
Well, Councilmember, we're making great progress in terms of our vaccination effort. Does that mean we should open up things completely and remove precautions? No. But it does mean that we can make some progress towards returning to normal. It needs to be incremental. It needs to be measured. It needs to be slow so that we can take a little bit of risk at a time and determine that we're safe at that stage of reopening before we progress. I think that's worked well for us in Austin and Travis County. I think it'll continue to work well for us. But I think, by the time we get to May and certainly the end of May, we're going to be in a much different threat scenario where we have, 50+%, 60+% of our community vaccinated. So it is going to change the risk profile and certainly put us in a better place to reopen responsibly.
Thank you for saying that. I do have a lot of concern about premature opening, but if we reach that point, and on our scale, do you feel like when we reach level 2 that we can start opening up a little bit more, or do we have to wait till level 1?
Well, our risk guidelines are measured based upon occupancy for businesses. So I think there's opportunity to increase the reopening process as we move to stage 2 and certainly to stage 1. But I will say that each workplace is different and poses different threats. Situations where people are sitting in offices are different from the risk when individuals are face-to-face in a customer service role. So we're going to have to look at each of these different situations, different workplaces, and ensure that we can do it safely. I will say that over the past year, as a community, We've seen businesses, we've seen city and county government modify operations, create protections that can keep workers safe. That combined with the masking and with the vaccination efforts means that we can make progress and we can start returning to normal as the situation dictates.
Thank you, Mayor. I'm through with my question, and I really want to thank all of y'all guys for the hard work that y'all been doing. It's just, makes me feel more relaxed and safe that, the message that y'all have been putting out to the public. And thank you.
Councilmember Kassar.
I think there might be some confusion around the headlines that came out about some of those appointments going unfilled last week. Can we confirm for people that because even though those appointments went unfilled, that those vaccines all went out because we end up filling those appointments later? Is that something we can really clearly confirm, that just because appointments went unfilled one day doesn't mean there was any reduction in vaccine distribution?
The appointments that were released on this past Thursday were for this week. So they were not for last week. And so they were for Tuesday moving forward. And so we captured those, added those to the ones we were going to release on yesterday. And so that's why we released 7,500 vaccines.
And so then they all wound up getting scheduled.
Yes. And so the goal is we want to release vaccines twice a week. And so Monday, what Monday picks up is Monday picks up the majority of this week. And then the ones that are released on Thursday, some of them do fill in like Friday, Saturday, but it starts to populate for appointments for next week. And so it kind of covers a 2-week span is what we have been working on.
And so can we be really clear with the public and with the press that we didn't reduce distribution of vaccines because some appointments went unfilled one day? We had wound up scheduling all of those yesterday.
Yes, all of them were scheduled yesterday.
Great, that's useful. Just because sometimes people read the headline and think, oh man, those 2,000 vaccines, I wish I could have had one of those. But the fact is, those 2,000 vaccines didn't get out any slower. And I appreciate y'all working on that. And just wanted that to be really clear. And then the second point is, as y'all open up eligibility, and I'm glad that you are, I just want to express continued concern about those lower numbers in Black and Brown communities. I know that's top of mind for you, for all of the departments, but the more that we can work to figure out as you open up eligibility, how to get to some of those frontline workers. I think that's really important. I understand that at the beginning, we were going to see more disproportionality because our older population is more white and our younger population is more people of color. But now that we're past that phase, I think figuring out how to really make sure that those frontline, front-facing workers get vaccines is really important. And so I just want to emphasize, as y'all start to work on the prioritization matrix and open up eligibility, just an emphasis on how do we get to those folks that are sometimes pulling still 2 jobs, both front-facing right now, who might be in their 30s or 40s, but we see so much more transmission in their community, and just really continue to urge that we do what we can to get to those folks that may not have time to sort out all the private providers. So thank y'all for your work on that. I'm confident and know that's what you're looking toward, but I want to just add emphasis there.
Councilmember Kassar, that is really one of the reasons why we did the pilots, because the pilots are closed locations where we are working with partners. And so it's really the way we've set it up is that overall our equity team is receiving those referrals and they are scheduling folks in the open locations. But then we are doing these partnerships where they are closed locations where we are partnering with entities like, for example, St. James and Sacred Heart. So the goal is that now that we have looked at those, we've reviewed those, we definitely want to do more of those and get more of those on the calendar. We've scheduled some meetings to just kind of talk with the partners that have assisted us with those. And so you will see more of those where we will continue to have the larger scale events that are open to the public going through the website, et cetera. But you will see some other smaller closed pod locations. One of the other areas that we have been piloting for about a week or so is the Dove Springs area. Looking actively reaching out to folks that have listed that zip code. We have secured a couple of partners that are actually going door to door in Dove Springs. And so they are going to start referring folks to us so we can provide the vaccines for them in Dove Springs through that location, because that has truly been, you know, a area that has been most hard hit. So we're going to continue to work through that. Then our goal is to look at a couple of other locations, like 5-2, for example, is another area that we are concerned about. So we're looking at where we've had high positivity rate and looking at how we can use the location to provide vaccines. Lastly, working with Central Texas Alliance has really allowed us to expand our operations. So they are an extension of Austin Public Health as they have their contract. And so they are also going to be setting up in different locations in Travis County to provide vaccines. So we are definitely have those things in the works.
Thank you for that. And as you work on 5.2, 5.3, I really think that a lot of people are still plugged in through their schools. And so that may be a really good way for us to hit phones or go door to door through those school parents. So thank you. Thanks to you both.
Thank you. Councilmember Kitchen.
Yes, thank you. And I also want to add my voice to my colleagues. Really appreciate all the work that our public health staff has been doing over a really extended period of time. It's so important for the community, and I want them all to know that they're appreciated. And we hope that they can find some time to take care of themselves and their families. I just have a very quick follow-up question. I think the mayor had asked about data, and I just want to confirm what data we can expect to receive. And let me be a little bit more specific in my question. A few weeks ago, we had received some information, I think from you, Director Hayden Howard, about some projections about when we might expect to get to, I think it was 80 or 85% vaccination rate. I'm wanting to know if we're on target for those projections, and what specific data we can expect to see. And I don't remember whether you let the mayor know that would be next week or after that, but what specific data we can expect to see so that we can track the level of vaccination in the community.
When we bring the data on next week, that will show what has been happening with CODA and community care. That is going to be helpful to at least paint a picture of the partners that we are working very closely with to share that. In addition to that, our team is meeting with with some of the providers on this Friday, just to kind of touch base with them. They are a part of the Vaccine Coalition Task Force, but they are the providers within that area. And so the goal is to, get an idea of what they are receiving as far as the vaccines that are coming to them, understand the type of targets that they have in place, and who they are providing their vaccines to. And so that definitely helps us to be able to paint a better picture. We're definitely, working with the state of Texas, as Dr. Scott shared on their website. It does show, that over 300,000 folks have received the vaccine. And we understand that there may be a little bit of a lag there. But basically having a better understanding will help us to continue to try to map out what we are anticipating will take us to get to that herd immunity. So we'll be able to share more of that on next week after we receive more internal data.
Okay, just one quick follow-up then. So what level of detail do you think we'll be able to get? For example, will we be able to get a breakdown by demographics, by age, for example, race, ethnicity, and location in town? To what degree do you think we'll be able to get that data, that level of data about who's been vaccinated?
So the data is going to mirror what we currently have on our vaccine dashboard. That will be the number of folks who've received the first and second doses, and then it will provide the demographic data as well.
Okay, and just as a reminder to folks, that demographic data is age, sex, ethnicity, and geographic also?
It does not include geographic location. Right now, it only includes just that demographic data, not the zip code.
Okay. All right. Mayor, I think we're just asking one question, right? Okay.
Okay. Let's go on then to Councilor Kelly.
Thank you. And thank you, Dr. Escott and Director Hayden Howard, for all the work that you're doing and that your staff is doing to help get our community back on track so that we can get over this COVID-19 pandemic. My question was about the isolation facility. Since it is located in District 6, I was wondering if you might be able to give us an update on how things are going over there with the 2 ISOFACs.
Yeah, so the ISOFAC 2 is in a warm state now with intentions to demobilize. ISOFAC 2. It hasn't held anybody. We don't anticipate that we're going to need a second facility in the short term. ISOFAC 1 has relatively low occupation right now. So, we'll continue to monitor that situation with ISOFAC 1 to determine if we need to alter the arrangement there. But again, the situation continues to improve. As we go through this month, if we hit May without any significant surges, then we may be able to avoid future surges given the percentage of vaccinations in the community. Currently, we've got about 37% of the adult population in Travis County with at least 1 dose. We anticipate that, as has been mentioned earlier, that allocations both to providers from DSHS as well as direct federal allocations to pharmacies and federally qualified healthcare centers are going to increase as well. So we're rapidly going to progress towards a state where we may start to be able to demobilize some aspects of the response.
That's great. Thank you very much for that update, and thank you again for the work that you all do.
Councilor Poole.
Thanks, and I'll add my congratulations and thank you to the staff for getting us through. And I think this is your 2nd anniversary for Public Health Week for the recognition. Is that right? Because we had just entered the COVID last year, so that's an anniversary. I'm hoping we don't see a 3rd one of next year. Dr. Escott, the 37%, that's using the 300,000, give or take, jabs against a little less than 1 million population. Is that kind of how we can sort of rough estimate the prevalence or the percentage of vaccinations for the city and the county?
Yes, Councilmember, it's 386,000 is the numerator. The denominator is 1.032 million for individuals 16 and older.
Okay.
So that's where that number comes from. Again, as allocations of Johnson & Johnson increased, it's going to modify how quickly we can get to herd immunity because it's a single shot. So it may hasten the goal. You know, it's possible we can get there before the end of May.
Okay, great. So close to 400,000 people have had their vaccinations. We have just a little over 1 million for our total population, which gives us that 37%. We're rounding up to 40%. Thanks.
Okay. Councilmember Ellis.
Thank you, Mayor. I certainly want to extend my appreciation too for all of our health workers. I know it's been a long haul. There's been a lot of twists and turns, and hopefully we're finally seeing a light at the end of the tunnel. My question is about, is there any discussion as you see weeks where maybe there are vaccines not distributed and you know that you can open up to another section of our population? Is there any consideration being given to people who are musicians, art workers, given the nature of their work, may put them in close contact with others strictly by the nature of their profession, but they may not necessarily have underlying health conditions or be of an age that already qualifies?
So, Councilor, the state hasn't built specific prioritization for occupations like the federal government has done. But you know, I think certainly if there are ways to provide specific outreach to groups like that through the Health Alliance, Musicians Health Alliance, I think it's called, then you know, I think that's a conversation that we can have. Ultimately, having partnerships with groups that are sector specific may help us to get that outreach to the folks who may have difficulty accessing because of the nature of their work or the challenges they face with accessing the existing infrastructure. So I think we're certainly happy to have those conversations if there's a way that we can provide that outreach.
Thank you. I know that's really important as we've seen, you know, how restaurants in particular have kind of been stuck in the middle of the conversation about being open or not being open. And so I really just know as people are moving from table to table, they may take every precaution they possibly can to stay safe, but it just seems very risky and many may not be able to access their vaccinations yet. So I hope that's a high priority as things progress. Thank you.
Thank you, Councilmember Coe.
Yeah, I just have a couple of quick questions. One, I just wanted to say thank you for sending out the link to those of us who were registered on APH. It took just 1 minute to kind of get myself out of the database, so thank you. That worked out really well. I wanted to ask about for a quick update on two different things. One is, and I apologize if I missed this, Dr. Escott or Dr. Hayden Howard, could you please give us an update on what the vaccination levels are of individuals staying in our pro lodges? And two, if you could provide us, there was great news last week about the effectiveness of the vaccination on the population of people who are under 12 to 16, and if you had any estimates on a timetable on that one.
I'll start with the estimates on the timetable. I think the best estimate right now is early to mid-summer for that 12 to 16 age group. We're probably looking at mid to late summer for younger individuals. So again, I think there's a strong likelihood that we'll have an opportunity to vaccinate or offer vaccines for that 12 to 16 year olds over the summertime. We had a conversation yesterday with our superintendents, encourage them to build messaging over the summer to encourage vaccines over summer break for those middle school and high school students, in particular focusing on the student athletes who return early in the summer for two-a-days and summer training, similar for other extracurriculars that start early like band. So right now, through the end of May, we're really going to focus on that adult population, and then we're going to have to pass the baton to getting our teens and middle school students vaccinated before the beginning of the school year. Hopefully by the end of summer, younger students as well.
Okay, thanks. I was hoping you were going to say it might be approved for that use in like a week or two, but I guess summer will be here before we know it.
Councilmember, I could be surprised. They are going after alteration of the EUA to include younger children. Even if it is approved next week, I don't anticipate there's going to be enough vaccine to effectively offer it to younger children until probably the end of May.
Okay, thank you, Dr. Escott. And then the Pro Lodges.
With the protective lodges, we are continuing to work on the protective lodges to provide vaccines to the individuals. I don't have the total number of vaccines that we have provided. I'll make sure to bring that on next week. As you know, we are working very closely with UT Health, Dale Med, and Community Care to continue to provide those vaccines in those settings.
Thank you very, very much.
Thank you. Councilmember Alton.
Thank you. Good morning. And I too want to add my thanks to our public health professionals for all the work that you do all the time, but particularly through this pandemic. I have some questions that build off of the memo that we received last week from HRD with respect to our employees and the vaccinations that are happening. I had shared some questions with HRD before we were making our decision on item 5. I didn't hear back, and I'm still interested in understanding some things better. I appreciate Director Hayden Howard's glimpse at what we're doing for our staff. I'm particularly interested in how we are prioritizing our frontline and public-facing employees. I want to understand better how that is happening, how we're notifying them, how we're identifying them. And then in the memo, it says that only staff that have been fully vaccinated will be engaged in public-facing interactions. And then elsewhere it says, and I'm trying to understand how that happens, because then elsewhere it says, well, we're not requiring a vaccination and no employee is required to notify us of their vaccination status. So I'm trying to understand how we are operationalizing a plan where only staff who've been fully vaccinated will be engaging in that type of interaction if we can't ask them and we don't know. And then I'm trying to understand how we are prioritizing our frontline staff, within our own system to make sure that they have access, some of whom don't have, city computers, et cetera. So I'd appreciate more information. And my questions originally were for HRD, but I think these are ultimately more health related, and perhaps you guys can answer them for the city manager.
Councilmember, I can certainly start and then ask our public health professionals to add anything that I may have missed. But there was a clarification that was made by our HR director on that Thursday discussion that the sentence around requiring any front-facing employee to be vaccinated should have been, that was an error. And so that was then subsequently omitted from the memo. And so that adjustment is being made. So we wanted to apologize for that in the memo, and we're making that adjustment. But we have sent out a full staff communication around the availability for vaccines for all of our staff. In that communication, it was very clear that front-facing employees will be prioritized. And as they register and get in queue, our public health departments and our HR departments are making sure that when we do have the availability, that we are prioritizing those individuals that have public-facing services that they provide. As you know, we have thousands of employees already that are providing those public-facing services. Thousands of them have already been vaccinated, but we will continue to make sure that as we receive more allocation, we are prioritizing those that are facing the public on a regular basis. But with that, Director Hayden Howard, anything I missed?
Yes, thank you, Spencer. I think one of the other things, just to remind folks is that as we look to open things up, we have to keep in mind that there has been a workforce of folks that have continued to come to work and to work with the public over this time. And so initially in January, we had a conversation with the Human Resources Department on how to prioritize staff. So a survey was sent out, and the survey was sent to all employees. And what we determined later is that there were some employees that did not initially respond to that survey. So they sent the survey back out again. They encouraged directors to remind their staff to respond to that survey as well. In the meantime, conversations were happening about how to prioritize departments that had frontline workers that were continuing to come to the workplace, continuing to work with the public, et cetera. And so the goal was to be able to provide those vaccines. And, I think the thing to keep in mind is that these are not mandatory vaccines. These are available. Our hope is we hope that 100% of City of Austin employees do receive this vaccine, but it is a choice. It is a part of their medical record. And so even though they may come in through Austin Public Health to receive the vaccine, going through public safety wellness clinic as well, that is not information that we can share with any director. That is a part of their medical record, and that is between Austin Public Health and that employee that we cannot share because it's not mandatory. And so as we continue to move through this process, one of the things that Austin Public Health has worked very closely, that has included Dr. Escott and Don Hastings in our environmental health division, is that we've asked directors if they want to submit to us any questions that they have, any way that they are setting up, how they're going to phase in their operations. They've had that ability to send that to Austin Public Health. We have reviewed that. We have provided them feedback about how to safely reintegrate and bring employees back into the workplace, as well as how to safely work with the public. And so we have provided that information to directors that have reached out to us to make that request. Lastly, the public safety wellness process, we did that as a bridge because we know that Austin Public Health staff will have access to either the City of Austin, the APH portal that's available for everyone, and we know some folks have come through that. But we also know that folks can use their insurance and go to a private provider. And then thirdly, we knew that we were working with Randall's, as we have in the past, for our vaccines to our employees. So that afforded 3 ways for folks to be able to receive their vaccine. And so our goal is that we want to definitely keep everyone safe. We want to be able to provide the vaccines working very closely with the Human Resources Department. And so that gives you an update. And so I understand that HRD is not here, but I would definitely say that if Ms. Hayes had any additional information, she could definitely share that with you on a later date.
Thank you. I think we share the same goal of wanting to get as many of our employees vaccinated. What I'm still understanding, still not fully understanding, is in those surveys that went out, which seemed to be the only way to identify. I know the first survey basically said, if you're 1A or 1B, fill this out. So a lot of people didn't fill it out because they weren't 1A or 1B, but that didn't mean that they weren't working on the front line. And then I don't know, I never saw the second survey. So I don't know what happened with that one. And so I'm just concerned because APH doesn't ever ask you that, you know, which department you're in and whatnot for that. So I just want to make sure that we're doing everything we can, you know, precisely for those people who have been working on the front lines and out in the public for a long time, making sure that they have access to the vaccines, and they may not have the flexibility in their schedule that's of some others, making sure that they have access to the vaccine. So, you know, I'm hearing that's what the intention is, and I hope that in practice that's what we're doing. I'm obviously not a director, so I'm not seeing all of the different pieces, but I appreciate the clarifications.
Great, thank you. Just real quickly to follow up on a question that Councilmember Poole asked, and just to get the data information in a little bit different form. Dr. Escott, the CDC has reported that at least about 40% of all U.S. adults have gotten at least one dose, and that about 75% of seniors have gotten at least one dose around the country. Generally, what are the numbers here in Travis County? We're close to, we're not reaching those numbers, but we're close to. But just from a percentage standpoint, do you have a feel for what the percentage of Travis County adults are that have gotten at least one dose, and what the percent of our seniors are that have gotten at least one dose?
So Mayor, yeah, there's always a bit of lag between what DSHS reports and actual vaccinations. The correct number on their dashboard is that 37% of the adult population.
In Travis County?
In Travis County. When we look at seniors, we've got more than 86,000 seniors who have received at least one vaccination. So it's of similar magnitude to the national numbers.
It's about 2/3 of our seniors, I guess.
Correct.
A little under 70%. Okay.
Correct.
Judge, I think those were all the questions that we had. I add again my appreciation for staffs, both city and county, that are getting this done. And again, we thank you for the opportunity to join you at this joint meeting.
Thank you very much. Greatly appreciate everyone's efforts as we get through this together. And so I will go ahead and adjourn the meeting of the Travis County Commissioners Court at 10:28 a.m. and pass it back over to the mayor. And then we're going to come back on in 5 minutes, which I'll deal with after the mayor and council leave us. So thank you very much, mayor and council, for joining us today.
Sounds good. 10:28. We're going to adjourn our portion of the joint special call meeting for the COVID briefing. 10:28 at 25 till 11. That gives us about 5 minutes. We'll see you guys back for the regular work session meeting that we have here today on April 6th. See you guys there.
Now you've no place to go. my advice for distracting yourself from the madness of being alone. Picture me there. Oh, picture me there. Yes, I'm Well, I dream today's a perfect day. In April, May, or June. The sun is shining in my face. The sky's a perfect shade of blue. A breeze is blowing